Hi, I'm Dr. Timothy Hodges. I'm an ophthalmologist here at Hodges Eye Care and Surgical Center. I've been performing cataract surgery for almost 25 years now, and during that time, I've seen a lot of changes. 25 years ago, cataract surgery was quite a procedure. It took a long time to perform, there was a lot of recovery. Today, the surgery is usually performed at an outpatient surgery center like our surgical center here, and it usually takes less than 10 minutes. The recovery is very rapid. In fact, today, I get very few questions about cataract surgery, the actual surgical procedure. Most people know somebody who's had cataract surgery performed, and they expect that they're going to have a relatively painless procedure with a relatively rapid recovery. Today, most of the questions I get are about the intraocular lens that we use during cataract surgery. You have choices today, and it can be very confusing. And I try to simplify it for my patients by breaking it down into three broad categories. The first category is what I call the standard intraocular lens that we've used in cataract surgery for a long time. That lens has been improved upon over the years. It's time tested. I assure people that it doesn't ever need to be replaced because it doesn't wear out. The second type of lens that we have today is an improvement on that first lens, and it can correct astigmatism. Now, both of those lenses are what we call monofocal lenses. Basically, what that means is it has a single focus. Usually, we choose that focal point to be in the distance. Most people think of it as shooting for 20/20 vision. If you do not have astigmatism, then the traditional monofocal, or we might call it the traditional standard lens, will work very well for giving you excellent distance vision. If you have astigmatism, then the addition of that technology to treat the astigmatism with the intraocular lens can also give excellent distance vision. Again, think of it as we're shooting for 20/20 vision. Now, there's a third category of lenses today that are called multifocal. And this is where it gets, I think, very confusing for patients because sometimes patients can read before cataract surgery. In fact, the normal, what I call age-related or old age cataract, sometimes doesn't affect the reading vision very much at all. And in fact, there are some patients, my mother was one of these, whose reading vision actually got better with the cataract formation. The distance vision dropped off. And a lot of times those patients will think that they might keep that reading vision if they choose the monofocal or single focus lens that sees far away. That's not the case. If you choose to have a standard or monofocal single vision lens for distance, you won't be able to read with that lens. That's where the multifocal lenses come in. The first multifocal lenses were introduced in the middle 1990s. I call that the first generation multifocal lens. It worked for some people, but it had a lot of side effects. And it was improved upon in the early 2000s with newer technology lenses. Those lenses gave people very good reading vision, but they often sacrificed the distance to achieve that. And a lot of patients didn't like that. The latest generation of the multifocal lens is actually called an extended depth of focus lens. Now, I'm not an optics expert, so I'm not going to try to explain how they optically change the lens to extend or draw out the focus. But the nice thing about that lens is it's not truly multifocal. In other words, it has a focal point, but pulls the reading focus in towards the patient without sacrificing that distance vision. That newest lens is made by Johnson & Johnson. It's called the Symphony lens, and it is our most popular multifocal lens today, and it is widely used throughout the world. What makes it so appealing is that it preserves that distance vision, and published studies have shown that the distance vision with the Symphony lens is really just about as good, or at least as good, maybe even better than a monofocal lens. And what we have then is a lens that can give the patient some reading vision without sacrificing distance? I think the most common question I get with the extended depth of focus or the symphony lens is, will I still need to wear glasses? And the answer is perhaps. I will tell you, our experience is more than half our patients are glasses free. But that means that there's a significant percentage of our patients that still wear glasses on occasion with the Symphony lens. I tell people the Symphony gives you good reading or okay reading. Maybe think of it as functional reading, the ability to see the dash on your car, the ability to see your cell phone, to see a text on your cell phone without scrambling for a pair of reading glasses. But I think if you're going to sit down and read War and Peace, you're probably still going to wear a pair of reading glasses. It's just going to be easier. The Symphony gives okay reading, but not great reading. The older generation multifocal lens actually did give great reading at a very fixed distance, but it did that at the expense of distance. And my experience is most patients really didn't like that very much, so I didn't use them very long. Another question I frequently get is, when can I start driving, or when can I resume my normal activities? Well, with today's cataract surgery, there are very few restrictions. Each surgeon has their own set of restrictions, but by and large, most of us allow our patients to resume pretty normal activities the next day. I even let patients drive the next day if they're comfortable, and if they're comfortable with their distance vision, and also, are they comfortable with using both eyes? For example, if they have a cataract in both eyes and they have surgery on one eye, that may cause an imbalance, and they may not be comfortable with that imbalance. And sometimes that will actually speed up the process to having cataract surgery performed on the second eye. As far as the distance activities, yes, you should be able to drive without glasses. The distance vision, we expect it to be quite good. I don't promise 20/20 vision to anybody. No surgeon can do that. I do promise that we aim for 20/20 or even better on every patient. And every patient's different. There are coexisting conditions that can affect how good the quality of your distance vision is. It's possible to be 20/20 and then have your vision vary, for example, because of dry eye condition, which here in Tucson is quite common. One of the things I highly encourage you to do is get all the information that you can find. Go to our website. Our website has the information. It can also send you to the Academy of Ophthalmology website, to the website of Johnson & Johnson, who manufacture the Symphony lens. Do your research. This is a big decision, and it's not a decision that's easily reversible. Once you choose the lens that you want to have put in your eye during cataract surgery, you should think of that as permanent. I think of that as permanent in a good way. I tell people that their lens will outlive them. We don't want to be removing this lens at any time in the near future. And once that lens has been in there for a while, it's not safe to take it out. So this is a very permanent decision that you're making. Don't rush into it. Find out as much as you can. I know what lens I'd have put in my eyes, and that would be the Symphony lens. We see the results every day from the Symphony lens, and our patient satisfaction with the Symphony lens, I think, is the highest satisfaction we've had with any lens, and that includes the standard monofocal lens that we've used for years and years.